when we talk about successfully resigning from PPO plans, we often talk about the benefits to the doctor or doctors in the practice. It benefits the owner doctor, of course. It can benefit an associate doctor as well. It benefits our team members tremendously because no longer do they have to feel like they are the proverbial hamsters on the wheel. But there's an entire another group of people that resigning from PPO plans benefit them as well. And that is your patients, your patients. Now, recently, a friend of mine, Dr. Josh Bernstein, he's a practicing dentist in Northern California. Some of you may know Josh. Josh shared something that I wanted to share with you because it absolutely hits the nail on the head in terms of why resigning from PPO plans is the best thing you could possibly do for your patient. Now, that's a different perspective. Josh wrote something about this. I'm going to share what he wrote. And I want you to think about it. Then we're going to talk about it. We're going to talk about some takeaways from his message. Let me read the message to you. This is Dr. Josh Bernstein, a practicing dentist in Northern California. Back in 1998, one of my patients had a badly fractured molar with an old filling that had decayed under the filling. I determined that tooth needed a crown. There is a, quote, standard of care that would have agreed. Not only that, but the dental schools would have agreed. The State Board of Dental Examiners would have agreed, and the courts would have agreed. But Triangle Insurance Company did not. Now, Naren, Josh chose to use the term triangle. Who's he talking about? What is
Delta?
Delta. But Triangle Insurance Company did not. Triangle, I'll keep using the word triangle because that's how he wrote it. Triangle said I should have done a very large silver mercury amalgam filling. If I had, by now, that tooth likely would have fractured again. Remember, this was in 1998, and he's writing this in 2023. If I had, by now, that tooth likely would have fractured again, needing a root canal, or perhaps the patient would have lost that tooth. Because I did a crown, that tooth and crown are still in good service in the patient's mouth 25 years later. However, Triangle only paid for a percentage of the filling that they allowed. The patient had to pay the rest. That experience, along with having a cost of living increase in my fee schedule denied by Triangle, convinced me that if I wanted to provide my patients with quality dentistry, the kind of work I was taught to do, I was going to need to get out of network with insurance companies. When I did, I was angered but not surprised to find out that Triangle wrote letters to my patients to tell them that they could save money by going to an in-network dentist. May be true in the short term, but not in the long term. And their letter was based on the false assumption that all dentists are alike. We are not. Going out of network with insurance was one of the best practice decisions I have ever made and has allowed me to follow the motto of Dr. William J. Mayo of the renowned Mayo Clinic, who famously said, "The best interest of the patient is the only interest to be considered." End of quote. Wow. What do you think of that, Naren?
I love it. I think sometimes if you change the way you look at things, the things you look at change. Yeah. This doctor changed the way he was looking at things back in 1998. And I bet his life changed, his patient's life changed, everything changed.
Josh is a friend of mine, and he's not only a brilliant dentist, he's just an incredible human being. I enjoy him, and I love this message. And, you think about it, and you think, Delta wrote the letter, say, hey, you'll save money to go to an in-network dentist. Well, would that patient have actually saved any money if later they would have ended up having to do a root canal and crown on that tooth?
No, not
or
only
what if
that,
they lost the tooth?
Exactly. And also the consequences, the health consequences, right? It's not just about money, but it's what's right for the patient.
What is right? That quote from William J. Mayo of Mayo Clinic, "The best interest of the patient is the only interest to be considered. So let me ask our listeners a question. It's rhetorical because I think I know the answer. Is it in your patient's best interest for you to be a participating provider with Triangle dental insurance? I'm going to politely suggest maybe not.